Can feel it coming in the air tonight. Oh, love. I don't wait for this all my life. Oh, no.
Moderator, this one shot.
Can you feel it coming in the air tonight? Oh, no. Well, if you told me you were drowning, I would not lend a hand. Seen your face before, my friend, but I don't know if you know who I am. But I was there and I saw what you did. I saw it with my own two eyes. So you can wipe off that grin. I know where you've been. It's all been a bag of I can feel it coming in the air tonight. Oh, love. I've been waiting for this moment all my life. Oh, love. Can you feel it coming in the air? Oh, love. Could I ever forget the first time, last time we ever met? Well, I know the reason why you kept your silence out. Know you want for me. The height of the top, the place you go, it's no stranger.
Depends on a broad range of adjustment measures. Although researchers and practitioners agree that the majority of children benefit
The sun, you just getting, you was for it.
about the impact on children's brain.
When you were there with the sun, I'm just getting down, but you care. Can you feel my hurt I have inside? Tell me what since occurred tonight. And you don't know it's taking its toll on me. Stood straight with your head at the wall. I don't want to hurt you. I don't want to need you. I don't want to hurt you. I'll go your follow me. I don't want to hurt you. I don't want to need you. I don't want to hurt you. Don't you follow me. The wrong don't make a right. This has to end. Words forever.
Other laws need to change.
I smile as you have my feelings from within. Where have you been? This love has never been an easy ride. Life always puts things in the way. I will never ever tell you dearly, cause I don't want it that way. I don't wanna hurt you. I don't wanna hurt you. I don't wanna hurt you. I'll go, you'll follow me. I don't wanna hurt you. I don't wanna hurt you. I don't wanna hurt you. Go, you'll follow me. Sure. I go to follow me. I don't wanna hurt you. I don't wanna hurt you. I don't wanna hurt you. I go to follow me. I don't wanna hurt you. I don't wanna hurt you. I don't wanna hurt you. I go to follow me. I don't wanna hurt you. I don't wanna hurt you. I don't wanna hurt you.
Yeah, so the present study is cross-sectional design and is based on the collected by Konrath surgery, one treatment, one cell, one therapy. Potential treatments will be therapy.
What is on me? I say, I have no thoughts. I don't lights.
Children living between more than 35% of the time with each parent were assigned to the group shared residence. In order to assess parental conflict, respondents were asked how often certain conflict situations occur between the parents. To properly consider the level of conflict, it is important to note that conflict between parents can be a sign of involvement in the child's life. On the other hand, low levels of conflict can result from minimal contact between the parents. Therefore, we also assess the frequency of contact. And for post-separation respondents, these items were asked twice in order to assess the current level of conflict and the period of 1 year before the separation. I think it's not working right now. So, yeah, perfect. Thank you. So father involvement in child rearing was assessed by 8 items, asking the respondents whether they or their ex-partner engaged more often in childcare tasks in 3 different areas, namely organization, care, and leisure time. We included control variables that, according to previous studies, are possibly related to the choice of post-separation residence arrangements as well as to child well-being. For participants who were assigned to the shared residence or sole residence group, additional variables were collected, like, for example, if the respondent is currently in a new partnership or, for example, the travel time between the parents' homes. We excluded cases where age was outside the SDQ range, where divorce or separation was within the last 2 years, because we know from the literature that the conflicts related to the separation decrease within about 2 years, and if there is no contact with the other parent. The questionnaire was accessed a total of 302 times. The final sample included 182 valid cases that could be classified into one of the 3 groups. Sole residence was the most common, followed by nuclear families and shared residence families. Gender ratio of the children was balanced. but a ratio of mothers to fathers is about 4:1. If we look at the categorical variables, we see that more fathers were among the respondents in the shared residence group, so gender ratio was more balanced in this group. It can also be seen that parents who practice shared residence live more often in urban living areas, so 50% versus 30% in sole residence. That they have a more a high level of education, also more often, so about 50 to 60 versus 20 to 30% in parents practicing sole residence. And that they live more often in a new partnership, about 70% versus 40% in sole residence. No differences were found in the frequency of custody proceedings and in the gender of the child. The metric variables show that the total problem score of children in sole residence is significantly higher. So more problems are reported than for children in nuclear and shared residence families. The average age of children in shared residence is about 11 years, in nuclear and sole residence families about 9 years. At the time of separation, children in shared residence are on average 6 years old, in sole residence about 4 years. The level of conflict in the year before separation is significantly higher in sole residence families. The current household income of residential families, sole residence families, is significantly lower than that of nuclear families. As expected, fathers' involvement in child rearing in the year before separation is higher in shared residence families than in sole residence families. And finally, children in shared residence change between the two households about twice as often in 1 month, so 8 times versus 4 times in sole residence. No differences were found in the household income before separation, in the current level of conflict, and in the travel time between the parents' households. Next, we looked in an explorative way which variables are related to the post-separation residence model at the time of separation. As it can be seen here, high education of the father, higher involvement of the father in child rearing, and higher age of the child are related to shared residence. And with this logistic regression, almost 80% of cases can be assigned to the correct group. At last, this table presents the results of linear regression for children's STQ total difficulty score. Model 1 shows the differences in children's well-being in relation to the residence arrangement. Compared to children in sole residence, children in nuclear families score about 4 points lower, and children in shared residence about 5.6 points lower, which means they have fewer problems. In model 2, we added the control variables, none of them being significant, but comparing the coefficients for residence arrangement between model 1 and 2, we observed that adding the confounders decreased the difference in STQ scores between sole residence and shared residence, as well as nuclear families, by about 20%. However, the differences in well-being remain significant. In model 3, we added the measure of conflict. As expected, conflict is correlated positively to children's emotional difficulties and is also significant. So a 1 unit increase in conflict is associated with a 1.5 points increase in the difficulty score. The difference between shared residence and sole residence decreases again by about 6%. And furthermore, the mother's level of education is significant in this model. Finally, the fourth model adds an interaction term to the regression. But if we look at model fit statistics, we can see that it indicates a worse fit than model 3. Looking at the interaction, we see that children living in nuclear families, shown in blue, and sole residents, shown in red, show the same trend towards more emotional difficulties when conflict increases. With children in nuclear families, in blue, they have lower STQ scores. And in contrast, the STQ scores of children in shared residence, shown in pink, decrease slightly as conflict increases. So to briefly summarize the results again, regarding the characteristics, in shared residence families, parents have higher education, live more often in urban residential areas, have more often a new partnership, a higher age of the child currently and at the time of separation, a lower level of conflict before separation, a higher involvement of the father in child rearing before separation, and more frequent changes of children between households. Looking at the variables related to the time of separation, a higher age of the child, a high level of education of the father, and a higher involvement of the father are significant predictors to distinguish between shared and sole residence. Regarding the effects of shared residence and conflict on children's well-being, the first two hypotheses were confirmed. So children in shared residence experience significantly fewer emotional difficulties than children living in sole residence, and conflict between parents has a negative influence on the well-being of the child. The third hypothesis, where we assumed that a high level of conflict is more harmful in shared residence, so the interaction was not confirmed. So it seems that shared residence is also beneficial when the level of conflict between the parents is high, although the interaction has to be interpreted with caution because there were very few cases with high conflict in the shared residence group. However, our findings also suggest that the positive relationship between shared residence and child well-being is in part at least a result of selection effects for two reasons. So when we controlled for possible confounders, we found that difference in well-being between shared residence and sole residence was reduced, suggesting that the control variables as well as parental conflict partly contribute to the difference. And moreover, our results from descriptive analysis at the beginning and also logistic regression suggest that the group of families opting for shared residence were already different prior to separation, which contributes to the decision for shared parenting. So to conclude, current evidence does not suggest that shared residence is a one-size-fits-all solution, as it is stated in the literature very often, that well-being is dependent on many factors, but it seems that on average, shared residence is beneficial to children's well-being. We have also seen that parental conflict has a negative impact on well-being, but the effect seems to be lower in nuclear and shared residence families, although there are contrary findings reported in the literature. To finish, our results have to be interpreted very cautious since this study has several limitations. Our results are based on cross-sectional data, a small sample size and convenient sample, parents' report on children's well-being, and moreover, the strong selection effects caused by the lack of legal basis for shared residence in Austria can be considered the most important limitation. Thank you very much for your attention.